Hello, everyone. This is Keith Stanley of the Near West Side Partners on a very special webinar today. I'm asking you all as you sign in, we got a number of folks coming in. If you can, tweet and let everybody know about the great thing that we're doing here at Near West Side with this webinar with the one and only U.S. Senator Tammy Baldwin. Senator, it's so great to see you. How you doing today?
I am doing really well. So glad to be in Wisconsin. We have a little break for the 4th of July holiday. So I've been got back to the state and traveling around. I'll be in Milwaukee a couple times next week. So looking forward to that. But thank you so much for having me today. I'm so excited about your work and your leadership and talking about how we can partner together.
That's right. And there's a lot to talk about. We're going to show U.S. Senator Baldwin. We're going to show a quick clip. Some people may know on who are attending that we work closely with Marquette University, and we're working with the PCOR project, which is Patient Center Outreach Research for our employees. And so we're going to show that video. Elizabeth, you have that video queued up. It's about a little bit over a minute, and so we can introduce people to that program and let people know where they get more information.
Hi, my name is Dan Pinto, Assistant Professor in the Department of Physical Therapy in the College of Health Sciences at Marquette University.
And I'm Abiola Keller. I'm an Assistant Professor in the College of Nursing at Marquette University.
We're both co-leads of the Patient-Centered Outcomes Research for Employees project, also known as PCOR.
And I also serve as a co-chair for the Health Working Team for the Near West Side Partners.
PCOR's purpose is to increase the voice in employee health and well-being and is part of Marquette's commitment to the community.
We hope that you enjoy this session with Senator Baldwin. For more information about PCOR, click below.
Thank you. Appreciate that, Elizabeth. And so, Senator Baldwin, we have a number of partnerships that you may be aware of in the Near West Side. We work closely with many of our major anchors, Harley-Davidson, Molson Coors, Marquette University, Forest County Potawatomi, and Advocate of Rural Health. And so we're trying to do what we believe is really best for the community for when it comes to quality of life, and that's just one of the partnerships. So before we hop right on in, because we have a lot to discuss in a very short time, and we wanted to make use of this time, and we're so honored to have you. This is absolutely amazing, so thank you. We want to start off with really just an overview of what you can tell that everyone's talking about. Make sure I get it right, ARPA, American Recovery Plan Act for 2021. We know there's a lot of changes. If you don't mind, Senator Baldwin, can you give us just the highlights? What is this? What is the American Recovery Plan Act? What might it look like for communities like the Near West Side across this country?
Yeah, so I'm going to talk about sort of what we've already done and what's still ahead as concisely as I can. But when we started this year, we had only just gotten the vaccines approved for emergency, use, and there was a transition in leadership, new administration, who proposed something called the American Rescue Plan, and that was, in my view, the way I talk about it is the bridge or the transition from being in the middle of a pandemic to being on the other side. Seeing it on our rear view mirrors. We're not there yet, but we're just, sprinting in that direction. And so the American Rescue Plan was intended, in my mind, to make that transition. So a lot of the resources in it went to getting shots in arms, getting the disease or the COVID under control, dealing with inequities in terms of vaccine distribution, also dealing with hesitancy, which we're still dealing with. We have, our disparities in who's getting the vaccine and who isn't are still way too disparate. And so working on that. And then it also focused on a couple of other major provisions. One is the economic impact of COVID. So there were small business programs there was aid to states and local governments, so the city of Milwaukee, the county of Milwaukee, because they'd spent a lot of money because of the pandemic. They're oftentimes the front line of response, the public health departments and other first responders, and setting up, ways in which we can have safe elections. For all of that costs money, and we were seeing cuts to local government at a time when the demands on local government were extreme. Small businesses. Not only did we continue some of the programs that had been stood up last year, but we added the American Restaurants, or the Restaurant Revitalization Fund. Live venues have been hurt the most, sort of the first to close, the last to reopen. I know that's a part of the life of Milwaukee and the Near West Side. Help for those venues to be able to not go bankrupt. And I do want to say something quickly, I think maybe of relevance to this group, about the Restaurant Revitalization Fund. I was actually talking to a restaurant owner who's I don't know if he's exactly, I think he is exactly in the Near West Side footprint, if you will. There was a program stood up for priority for small businesses that hadn't been able, small restaurant businesses that hadn't been able to get help through other programs, who were minority run, veteran run by people with disabilities, other underserved populations. And there was a restaurant owner who was approved for a grant as one of the priority set-asides. And somebody filed, or 2 lawsuits were filed challenging the racial designations to prioritize in that program. And a court in Texas issued an injunction and said, you have to share this money among all applicants. You can't preference based on race or other criteria. And so this restaurant owner got called back up, basically, or emailed and say, the loan we just promised you, you're not getting it. And he's devastated. And I just want to say that we're going to fight to figure out how we can rectify that situation. But I just wanted to mention that in the course of talking about this, that as we try so hard to close disparities, there are those on the other side trying to make it more difficult for us to take those actions. Okay, so back to what's in the measure. The American Rescue Plan also has a lot of provisions that change the tax code to make it easier for working people to get ahead. And I just want to mention too, the earned income tax credit was significantly expanded, and the child tax credit was significantly expanded and made refundable. So starting July, starting next month, moms and dads, parents, working parents will see a significant increase in their child tax credit, and they don't have to wait till they file their next year's taxes to see it. It's going to come in monthly. And that is significant enough. It's predicted that almost half of all children living in poverty will be lifted out of poverty by those 2 tax changes. That said, as I described the bill, it was meant to be a bridge from the pandemic to getting beyond. Those tax changes are only right now in effect for a year. And so I want to do everything we can to extend that amount of time, because we know that working parents, especially low-income working parents, need a level playing field when you think about the expenses as well as the joy of raising children.
Senator Baldwin, I just want to let you know that just warms my heart. The Near West Side, we have about 25,000 residents who live in the Near West Side. About 50% of them live at or below the poverty line. And for the work that you're doing means so much to us. So thank you, thank you, thank you. I really
Thank
appreciate
you.
that.
Well, and then I've already talked too long, but let me just say, I'll give you a sneak preview. Looking ahead, a lot of people have heard discussion of Joe Biden's American Jobs Plan and the American Families Plan. The Jobs Plan is about infrastructure and manufacturing and making sure that we build back better, just to coin his phrase, right? And we have neglected our infrastructure, and it affects everyone. Getting to work, getting to where you need to do things. Biden included transit as a huge piece of what he's doing, looking at who is able to own a car and who has to rely on transit. And there's a very strong focus on our water infrastructure and getting rid of lead pipes that go to homes or schools. It's just, as he talks about building back better, it's inexcusable that it will take, decades longer to get rid of those lead laterals. And he proposes to get rid of them in the short time frame. It also includes broadband, both affordability and accessibility. So it's a very visionary, large scale proposal. Today, if it was passed tomorrow, we would not have the workforce to get those jobs done. So the American Families Plan looks at how do we support that workforce? How do we support skills training? How do we make sure that moms, for example, who can't go back to work during this pandemic because their kids are still either at home in school or because their childcare center has closed. And the American Families Plan is about all of that. I hate the expression human infrastructure, so I'm going to try to avoid using it. But it's an investment in the people and the workers who will build that infrastructure or bring some of these manufacturing jobs back.
That is so exciting to hear. Really excited that these programs are really, all the things you're speaking to really reference the Near West Side, whether it's the lead laterals, the families getting back to work, that is the Near West Side population. So that is really amazing. Anything else you would highlight with as far as the current, the ARPA, or anything else, as you mentioned, as far as the other?
So what I would want to mention is that the things I talked about looking forward, I am hopeful, but they are not law yet. And we're going to be spending several months. When we go back into session after the July 4th holiday, we're going to be working on both a bipartisan infrastructure measure, as well as a measure that we're going to use a special procedure known as budget reconciliation that can allow us to pass it with a simple majority rather than the super majorities the US Senate usually uses. So it can't be filibustered, I guess is what I'm saying. And so what we can pass on a bipartisan basis, we want to work in a bipartisan basis to pass. But there are some really critical elements, some that I've listed, some that are too numerous to list right now, including immigration, and climate change, but huge issues that we're not sure we can get passed in a bipartisan way. We're going to try to do as much of that through budget reconciliation. And then I would say a September timeframe. But why do I mention that? If it's not law yet, that means you can speak out, talk to all your congresswoman, who's going to be really very helpful and a partner in all of this, but also my counterpart in the Senate and any other folks that that you can touch to try to raise the pressure to pass this. It's visionary. It's a once in a lifetime opportunity. We need to do it.
Senator Baldwin, that is so good to hear. That is one of the questions that it's always in the back of my mind. How do we support you? How do we support your work? I have the privilege of representing the Business Improvement District, and there's about 370 businesses. And I mentioned those anchor institutions, they're all a part of it. We are happy to explore ways that we can write letters of support, write ways that we can just, once again, elevate what you're talking about and make sure people are aware and put pressure where we need to put pressure, because we want to make sure that our communities are healthy. I do have want to go into, we have about 7-8 questions that people have sent out to us. I don't know if we're ready for that yet. Before I go and transition to those questions, anything else you want to add before we go to those questions that you think is important for our group of people for today?
Anticipating some of the questions that you might ask. I think you'll hit on some of those so I'll wait for the questions, and then we can finish up with anything that's been left on the table.
That's right. I have to admit, I'm gonna wait till last, but I do want to just FYI. I woke up this morning, heard the story about the 100-year drought and how it's affecting some of our residents out west. I would love to talk about that if we have time later on to see if there's anything we're doing about climate change. But yes, we'll get started on these questions here first. So as I mentioned before, Senator, we have a number of partners. I mentioned over 370 businesses. We actually have close to 100 nonprofits, and we have some great nonprofits. One of our nonprofits that we work closely with is Progressive Health Centers. Progressive Health Centers, led by Jennifer Sinovic. She has sent a couple questions in, and we're going to try to get these questions in and then go from there. So the one is about, how can health entities best support transitions to the community for formerly incarcerated individuals? I know you've been working with some things on that. The context in, and we won't read all of it, but this fits into the reentry work Progressive is doing with our Transitions Clinic Network program in partnership with the Advocate of Rural Health. We'll be particularly interested in finding financial sustainable options for community health workers that support this Transition Clinic Network. Any thoughts just in general on our formerly incarcerated individuals, and how do we support them as they transition so they can be healthier individuals?
Exactly. So I wanted to focus on a measure that I have introduced called the Medicaid Reentry Act. And by the way, I convinced a Republican member of the Senate to join me in sponsoring, so it's a bipartisan bill. But we all know that people who are incarcerated can face significant challenges with reentering the community, including difficulty accessing needed physical and behavioral health services. I think particularly that our jail and prison systems are not particularly great at, say, drug use disorder treatment. And so the idea to maximize success would be to have Medicaid start to cover the incarcerated individual 30 days before release, so that there can be what we call a warm handoff to healthcare. So you don't have to lose weeks, sort of, how do I figure out how to sign up? How do I get it? Then how do I find a healthcare provider? And especially for those who, we know a disproportionate number of people who are incarcerated have behavioral health issues, and that warm handoff to professionals who can help right away really, really improves the chance of success. So we are trying to get that measure passed, maybe as a part of the American Families, the bipartisan bill, or because this is about our workforce too. I mean, it's first about individuals with struggles, and you want to make sure they're getting the right care, but it's also about getting a good paying job that can support a family is one of the key indicators about whether you're going to stay a part of the community, or it'll lessen the chance of recidivism.
Thank you. I appreciate that. Jennifer has another question from Progressive. What are your priorities to reduce inequities in postpartum care for moms and babies? Context, once again, we serve roughly 250 prenatal patients a year with Progressive, and we'll be adding a second OB-GYN later this summer. And I would imagine we've had the opportunity at the top of the program here. You saw Dr. Dan Pinto from Marquette University, along with Dr. Abiola Keller. I know Dr. Abiola Keller from College of Nursing has been focusing on this. Definitely some disparities and inequities when it comes to specifically African-American communities, prenatal care, even up to birth and after birth. Any insight, any priorities? What are your thoughts on that? Anything you're working on?
Yeah. Oh, we are really being active legislatively in this space, but I want to take it sort of local first. And that is, last month I had the honor of participating in a roundtable discussion with a number of advocates and leaders in the African-American community in Milwaukee, including now advocate mom who lost her first baby because of some of the disparities and inequities that exist. And she told her story, and it was so powerful. Advocate for breastfeeding for Black moms. It was an advocate for sort of the local initiatives that are going on. And it was just, it's one thing to hear statistics. It's another thing to meet somebody who lost a baby. It's another thing to hear people talk about their experiences during their pregnancies, and how they feel that those were probably different than white women's experiences or other people's experiences. So anyways, I wanted to start there and then say that I think we have a number of really promising things that we're working on. I want to highlight a couple because there's probably a dozen. And so the first I want to mention is a bill I lead, and the House leader is Gwen Moore. And so we're teaming up together, which has to do with making the maternity care workforce more diverse and more plentiful, because we have workforce shortages there. But so there's greater cultural competence when we are talking about services, healthcare services. Doulas are very important pieces of navigating this healthcare system, and so part of the legislation also focuses on increasing not only the doula workforce but also knowledge about it, so that people can seek that help. And again, with a real emphasis on diversity in those workforces. So that's the piece that we're championing. All of the other ones I'll talk about, but Gwen and I are the leads on the Perinatal Workforce Act. Another one is changing Medicaid policy so that we move from coverage, which is limited right now, I think, to 60 days following birth, and is narrowly focused on any pregnancy or postpartum related complications. Extending that to a year following childbirth, and stopping that limitation of the only Medicaid coverage you're getting for that year is around pregnancy complications. Now let's make sure that whole baby and whole mama are covered, and we're not just looking at reproductive issues, but we're looking at whole health. That is also going to be really helpful in more successful outcomes. And so that one I think is really really important. We also were able to pass legislation that incents states to adopt the 12-month coverage. But we know we come from a state where not all those incentives that have been offered to get the state to expand Medicaid have resulted in success. So while that's sort of already advanced, we think making it a federal requirement would be a positive thing. So that is, and then the last one I would mention is something we're calling the Momnibus. We have the Mommies Act and the Momnibus. The Momnibus is basically an omnibus bill that has all of these things that I was describing together included in it so that we could pass them all at once if we wanted to. So there you have it.
I appreciate that. That is exciting. I like how you have spoke of, if I can use this term, almost like holistic viewpoint when it comes to the doulas. I think that is so important. Having that navigator, if I can say, that is great. And I'm glad you've been able to really connect with the people that you represent and say, listen, what is needed? And so I thank you for that. I appreciate that.
Thanks.
My next question is coming from a young man who runs a program, Community Now. And he's just a great guy, Shannon Ross. He's the executive director. He asked, Senator Baldwin, you've supported both greater representation of minorities in STEM fields and criminal justice reform. What do you think of the importance of pre-entry and correcting the narrative about people with criminal records that groups like the community focus on? He mentions their work is premised on showcasing the successes, humanity, and agency of people with criminal records. Any thoughts on how do we continue to help our brothers and sisters who are coming out of the prison system, and we get them connected to, quite frankly, you mentioned earlier, there's a lot of jobs, and we, even if we wanted to, we can't fill them. How do we help out that population after they've done their time? How do we get them back to be productive members of society?
Yeah, I wish there were more resources during the time of imprisonment for sort of pre-exit, workforce training. There are some, but they are very limited. And so frankly, I feel like that's an issue, just like, having drug treatment programs, et cetera, in prisons and jails would be, again, they're not totally absent, but they're not there in with the sufficiency that we really need to give people a running start, if you will. So I do think because of the workforce shortages that we have right now, that we do have a moment of opportunity where, in a time when there's an overabundance of workers and not enough slots, you'll see an application. It looks like there's a 5-year gap in employment history. You kind of put it on the side, and that's not where you go. Even if they don't have, the ban the box movement where they haven't even asked you, but you just see this gap in employment history, and that alone is enough for somebody to put it aside and look for somebody who's ready on day one. But at a time when employers, especially in manufacturing, are telling me, I could hire 11 tomorrow, I just can't find them. Somebody has to play matchmaker here. Somebody has to play matchmaker and say, whether it's, whether some of these jobs do not require a degree of any sort. And then, yeah, we have to play matchmaker. We also, I suppose in some cases, when you're re-entering, you have to find a place to live if you're not going back to a family. If that is an opportunity, then location, even just as something as simple as let's find a location where there are jobs versus a location where there's high unemployment.
That's right. I appreciate that, Senator Baldwin. That is a big one for us to figure out how do we help these people get back to where they need to be. And I like you mentioned it, which I totally agree. We're missing that the opportunity. There's a gap there to do some pre-training or just whether it's just soft skills and get them ready to be in position to be hired. That's a good one. Moving on so we can keep the time going. We got a couple questions going back to ARPA. So, whatever you can answer. I know there's a lot of still moving parts with that act, and so whatever you can answer. This one is, what is included in ARPA for housing stability and affordable housing for communities who have been disproportionately impacted by the pandemic? This is key because I just know the pandemic has exacerbated, has really brought to light some of those inequities we see in the Near West Side with the movement to extend the eviction moratorium, that people who don't have jobs are still trying to figure out how to pay, not only rent, but those even with mortgages. Any insight as far as ARPA's role with helping with housing stability?
Yeah. So let me divide it into the bill we already passed and then the bills that we hope to pass with everyone's involvement and help. During the pandemic, the series of bills that were passed last year and then the American Rescue Plan that was passed at the beginning of this year, there were various tools like moratoria on evictions and foreclosures. Really important because, being displaced is tough enough at any point in time and has serious ramifications. But in the middle of a pandemic, it's dangerous, right? It's just dangerous. So those have been helpful tools, but obviously the moratorium will go away at some point and there will be a lot of outstanding debt and we're just going to have to figure that out. We also have an insufficient stock of housing generally, but certainly affordable housing or subsidized housing. So in the infrastructure bill that President Biden has proposed, he sees a really big role for HUD and for some other, so housing and urban development, I'm sorry, not everybody is familiar with the acronyms of Washington, but so he sees a very strong role with housing and urban development, which my former colleague, Congresswoman Fudge from Ohio, is now the Secretary of Housing and Urban Development. And she, from Cleveland, had all sorts of hands-on advocacy in this arena. I'm so glad she was selected to fill that role. But I think she's going to be really pushing to strengthen some of the subsidy programs and working with others who can help with the development of greater amounts of affordable housing. Biden sees this as part of infrastructure. So when we heard the initial pushback, half of this bill or 3/4 of this bill isn't even about infrastructure. Well, I think housing is basic infrastructure, but they were sort of seeing roads and bridges. So when the bipartisan bill came out, it's not bill, but the agreement that was reached last week that they heralded as the bipartisan infrastructure agreement, that doesn't have housing in it. So that's one of the very issues that we're going to have to carry over to this process called budget reconciliation that would allow us to pass a measure with a simple majority in the Senate, which isn't usually the case. Usually we need 60 votes to prevent a filibuster, but this would be filibuster proof if we do it in that with that process. I hate to get in the weeds, people's eyes glaze over what reconcilable. Anyways, that's how we hope to address some of the housing issues.
I appreciate it. And to let everyone know who's listening, our numbers are still going up on Facebook, numbers still going up here on Zoom. People are definitely interested. It's really exciting to see. And Senator Baldwin, they're all here to see you. So this is exciting.
They're here to see you too.
And I do want to mention, for those of you who have questions, feel free. We don't have the chat function open, but we do have the question function. So if you have a question, I see a lot of familiar names on the list. Feel free to get your question in now, because we're going to start going through some live questions once we finish up wrapping this up. So Senator Baldwin, the next question, in light of the pandemic, and this is kind of similar to the theme that we've been discussing so far, in light of the pandemic impact on communities of color and women, what provisions are included in ARPA to support communities of color and women-owned businesses? You kind of mentioned a little bit about that, but anything, anything you want to add?
Yeah, so in the American Rescue Plan, actually, I'm going to look over the whole past year because of we passed multiple pandemic-related bills last year under the previous administration. And what I want to say about those is that when we stood up programs to help small businesses, we sort of created them out of nowhere, right? And when they were implemented, like the Paycheck Protection Program, SBA, I'm going to try not to use acronyms, and the Small Business Administration implemented a program that didn't exist before the pandemic called the Paycheck Protection Program. People initial it PPP. And it was through where you banked. So you're a small business owner, your bank would write out the application with your assistance and then submit it to this Small Business Administration, and they would approve a loan that might even be forgivable, but allows you to stay afloat during the early days and mid days of the pandemic, where you might be closed down because you had to be, right? So what happened in the first round of these loans and grants, people who banked with the big banks got the first loans. They were all ready to go. They put all their personnel. Sometimes they filled out the applications before even asking the small businesses if they wanted a loan. You wouldn't believe some of these. And I immediately started hearing from, the Black Chamber of Commerce, Black and brown owned businesses saying, how do we access this? And so it's like, well, through your bank. Well, I'm unbanked. I put my life savings into starting my business. I probably couldn't have qualified for a loan. I don't have a bank, right? Or that's one example. We know a lot of people put their life savings into opening something up. And it also, the program also favored banks that had previously worked with the Small Business Administration. So if you're banking with a community bank or a minority serving institution or CDFI, Community Development Financial Institution, trying to avoid the acronyms, but I have to remember what the letters stand for. Those businesses were not helped in these first rounds. So to answer the question, as we went back, we named the problem. It was a problem. And when we put more money into the program, we required the Small Business Administration to first prioritize applications that were now coming through minority serving financial institutions or community development financial institutions, or those who were unbanked and and needed extra help with the application process. And so I think while it didn't eliminate the disparities in the program, it helped temper them as we move forward. And, if there are going to be further pandemic related programs, we're gonna have to figure out how to do that. But I do want to raise the alarm of this lawsuit that I was talking about. That was in the Restaurant Revitalization Fund. So right now that only affects restaurants. And the idea was that certain multi-billion dollar amount of the whole program was set aside for priority restaurants, and they're prioritizing entrepreneurs who are part of underserved communities. And there were 2 lawsuits filed saying you can't be race specific, you can't be, and kind of like the battles on affirmative action a couple decades ago. But this Texas judge, with one of the cases in front of him, said program has to be suspended, and you have to, share all the funds on a first come, first serve, or some other basis. And we're gonna have to figure out how to address that. But there was a lot of well-meaning policy in there, recognizing again disparities, racial disparities exist, and then thwarted in doing that. I think we'll see lawsuits in some of the other programs that are out there. I think the U.S. Department of Agriculture, in its efforts to help redress the discrimination faced by Black farmers, historic in nature as well as present day, I have a feeling there's going to be issues there. Now, I know you don't have a lot of farms in the near West Side partners. So sorry, I digress, but I use that as an example of how this battle is ongoing.
Well, I will say this, Senator Baldwin, we do have a farmer's market, and we rely on those farmers coming from up north to make sure they have their produce at our farmer's market at the Main Street Oasis. Yes,
and
it's indirectly impacts us.
I wouldn't be surprised if a number of those produce farmers are Hmong.
You're right.
And
you're right.
And because of their traditional farming practices, et cetera, they hardly qualify for any USDA assistance, unlike others. And so thinking about that too, where sort of ethnicity and race, that's where these disparities begin, and we have to think about those. So thank you for buying their produce.
That's right. They're great. I love the zucchini. It's not out yet because it's too early, but the zucchini I will definitely get my hands on. I do want to give a shout out, Senator Baldwin. You mentioned about the work regarding some of the minority-owned business of color and women-owned businesses. The 707 Hub at Marquette University. Kelsey Otero leads the 707 Hub. She's absolutely amazing. She's been working with us since the start of the Near West Side. We brought in over 40 new businesses in the Near West Side, Senator Baldwin, and 60% of them are either fall in the category of business of color or woman-owned. And it really has a lot to do with Kelsey and just being her dynamic, inspirational work she does. And so just to give a shout out to her. And we work with those businesses as they struggle. As you mentioned, how do we pivot, COVID-19 and the pandemic? We work with these businesses to pivot and so they can use the Grubhub and all these other services to figure out how they can still sell food. So absolutely amazing partnerships within our community. We're rounding the corner here on the last leg of this interview, so we know you can get back to doing all your great work that you do. So just a couple more questions. Do want to go back to, I mentioned, and many people saw the video of the patient-centered outcome research work. Once again, Dr. Abiola Keller, Dr. Dan Pinto, they do great work. They focus on with this project, we call it PCOR. They focus on really how do we give voice to employees of the Near West Side to help them with some of those issues. And that has really came to the forefront with the impact of the pandemic. Do you have a question for you as far as mental illness? Any thoughts as far as the work that we're trying to do on the federal level to address just the impact? Now, there was already a concern before the pandemic, but even as the pandemic hit us, whether people are working or not, mental illness is affecting Americans across this country. Isolation is a major issue. There's a lot of things going on. Any insight from your perspective as far as mental illness?
Yeah, so several things that I would, first let me just name some of the challenges. And that is that we have a workforce shortage there too. So we do not have enough psychiatrists, psychologists, trained therapists, certified therapists, substance abuse counselors for all the need that is out there. However, there's some good news about ways in which we can use the resources, human resources, as well as other resources to sort of expand our reach. So one thing that happened during the pandemic is telehealth really, excuse me, grew from something was a tiny part of the practice of medicine to something that was, unless you had COVID, you were going to see your doctor or your nurse via telephone, audio only, or during, Zoom or FaceTime. And at first that was going to be an issue because Medicaid, Medicare, some of the private insurers won't pay for a visit unless it's in person, but they had to move quickly and they did. So now people who have like stigmatized illnesses where, and we know that mental illness is something that sadly in our society still bears stigma. We know that having substance use disorder is something that has a lot of stigma. And so people in some ways felt more comfortable accessing their healthcare from their homes with telehealth. And so there's some efficiencies there. It doesn't address the the fact that, some people still have to wait too long to get their initial appointment because we don't have enough people in these professions to do the job, but it does create greater efficiencies and I think keeps a lot of people more willing to seek the help. You're absolutely right that the pandemic exacerbated so much in terms of depression, in terms of other mental illness and substance use. The number of overdoses has increased fairly dramatically, and it was high before the pandemic began. So we have a lot of work to do. So one of the things that we have done is help the states, at least for a program like Medicaid, try to help the states increase their reimbursement levels for these necessary services, recognizing that this is a real crisis right now. And that should ease things in a number of ways. It would help decrease the barrier of affordability of this care. But we've never paid those professionals and you know what they're worth and for the difference they make. And so it would allow better reimbursement, at least for those programs like Medicaid. And we have to do more along those lines, and we have to keep reimbursing remote access through telehealth. And not go back, you know, oh, the pandemic's over, we're going to make everyone go back and sit in the waiting room with all the other people waiting to see their, you know, their therapist or whatever. I think, well, anyways, we have a bigger reach with telehealth.
I'm glad you brought that up. I had the opportunity to see several times Advocate Aurora Health. They actually have Aurora Sinai in the Near Side, one of the last remaining hospitals in the city. Advocate Aurora Health has been a great partner of ours, and they were practicing telehealth before the pandemic.
Yeah.
And great to see how they could use that service, as you mentioned, for efficiencies for many of our residents that live in the side. Just for the sake of time, I'll put two questions into one. Feel free, Senator Baldwin, to address however you want to address it. One is a voice of political change. Any thoughts? And this is kind of more of a generic question. It came from one of our live audience members. Any thoughts as far as how we can increase our voice as far as political change, any way that we can be more active in anything? That's the first question. And then anything you have to say about the climate change, and then we'll wrap it up.
Okay.
Sorry if that was much, so please forgive me.
Well, there's individual action, and then there's naming the type of legislation we're seeing in states across the country trying to limit people's political voice and opportunities to participate at the ballot box, and transparency on who's trying to buy our elections and influence the outcome of our elections. All really important things. So let me just make that first question into two. We have to pass something called the For the People Act, which would create some national election standards, national standards for federal elections, which is all we have control over at the federal level. However, they will trickle down. Most things don't trickle down, but they would, because what state is going to separate the date of elections for federal officials versus state officials just to get around the For the People Act? So it's critical. Right now, we do not have enough Republicans supporting it to avoid a filibuster. You know, filibuster means that you have to have 60 votes to pass something. And so we're just going to keep on fighting. We're going to keep on fighting with the rules we have now. And we're actually looking at whether we're going to change the rules to make it harder to filibuster such an important piece of legislation. So that's that. Then how, as individuals, well, first of all, we have to vow to always utilize our election franchise. I'm gonna vote, you're gonna vote, right? And so, you know, everybody else has to do that. And you're gonna tell friends, and you're going to, you know, we're all busy, but stay informed. Who's for what? Who's on your side? I'm not gonna agree with anybody all the time. I have a joke about that, but anyways, but there, you know, whether you're voting for the lesser of two evils, it's better to have the lesser, or whether it's somebody who's a great champion 90% of the time. So the joke is that one of my colleagues said to a voter, yeah, you're never going to agree with a candidate 100% of the time. And then he said, well, I take that back. When I first voted for myself, when I first ran, I've agreed with myself 100%. But by the second time I voted for myself, I already let myself down in a couple of ways, you know. And so even I didn't agree with myself 100. Anyways, that was the joke. So the other question, climate change. Joe Biden's vision of his infrastructure plan is very much focused on climate change. So if you think about where climate change comes from, it's, emissions, and so you have the electrical or energy generation, you have manufacturing, you have buildings that use energy, you have agriculture, and there's other pieces of that pie that I'm missing. But some of, like, in energy, part of Biden's plan is to get the type of transmission lines and distribution lines that allow us to put more solar and wind energy into our grid. We have an infrastructure for distributing electricity that kind of starts at the power plant, which is either going to be coal or natural gas, and then it's distributed to its service area. And if we're going to get it off the wind farm in Iowa or the solar farm in Wisconsin, you have to create a different type of grid. So that's one of the infrastructure investments that didn't make it really, I think some of it's in the bipartisan bill, but we may have to handle separately. So there's the other thing I'd say is, while we're having droughts in the West, we have had so many extreme flooding events in Wisconsin that are wiping out our infrastructure. And one of the mistakes the federal government used to make is say, when you repair it, you can't make it fancier, you can't make it stronger, you can't make it more resilient. You just have to build it back to the way it was before. Well, from the president who coined the phrase "build back better," we don't want people to go on a spending spree, but if that bridge has backed up when the ice comes and the trees and the river come and get against it, and then the whole community floods because water's not going under the bridge anymore, and the bridge gets wiped out, well, how about we build it a little bit higher and a little bit wider so that that doesn't happen again? And when a road gets washed out, how about a bigger culvert under the road? Those are simple. Penny wise, pound foolish is what our old policy was, and we need to change it. And those are just a few examples of things we hope to do on climate change. There's a lot more that we need another hour to talk about.
I know. Senator Baldwin, this has been absolutely amazing. It's been a delight, and I'm so glad I had another chance to see you. It was some years ago when I was there in Washington, D.C., and you were just amazing. I got a chance to meet many of your colleagues, and just amazing. As we wrap this up, I want to give you the floor for last final comments, anything you would like to add to our audience. We have people from our anchor institutions, we have residents, we have businesses, both on Facebook and on the Zoom conference. Anything you would like to add as we wrap this up?
Yeah, I want to just give a shout out back to all the participants, and you, of course, too. There's that old expression, I think it was Tip O'Neill, all politics is local. But I started in local government. My first office I ran for was the county board. And it was so hands-on. And there was this sense of, I knew what the issues were, all of them, in my little neighborhood that I represented on the county board. This is, just unlike Milwaukee, we had this massive county board. So I represented 10,000 people in a small neighborhood. I knew most of my constituents, and if there's something needed to be done, we work on it. And I have missed the intimacy as I've gone to higher office. But I want to say that I also elected to do that, and the voters elected me to do that because it would have larger impact in some ways. Creating a small business rescue program during a pandemic that would impact small businesses across the United States, and in some cases make the difference between whether they made it or didn't. But you don't see it as much at the local level. You do. And that's why our partnerships are so important. And you're the ones that are going to have eyes on and accountability for, the state sent this over, the federal government sent this over. And now let's make sure it does what it was intended to do and helps build and elevate the Near West Side accordingly. So thank you for all you do, and thank you for having me on today.
U.S. Senator Baldwin, it has been a pleasure, and I really appreciate you taking the time out. I know you are doing quite a bit on the federal level, and just for you to take the time out and speak to the Near West Side residents and community and stakeholders, we really appreciate that. So it's been a blessing for me to be able to get a chance to interview the one and only U.S. Senator Tammy Baldwin. So with that said, we're going to wrap it up. I just have a couple announcements. I want all our residents and our community stakeholders to know that we have our July our Appreciative Inquiry Summit coming up, July 21st to the 23rd. If you're interested, we will be sending an email out. And as usual, if you're interested in learning more about the Near West Side, please visit our website or our Facebook page. A lot going on this summer. You probably saw the planters on 27th Street, but there's so much more. With cameras, we're installing lights, we're installing our signage on our streetscapes we're doing. So feel free to reach out to learn more. With that said, I'm glad everyone you got a chance to join us. We will have a link to this video on our YouTube channel shortly, so be on the lookout for that. With that, enjoy this beautiful, beautiful Wednesday, and go Bucks go. Bye, everyone.